Welcome to Marian Ayurveda. In today's episode, we are going to discuss a condition commonly referred to as stomach pain in children. For many parents, it is a major concern when their children experience stomach pain, and they often struggle not knowing what to do or what the reason behind it is when the child is in severe discomfort. In this episode, what we wish to discuss are the 5 to 8 causes that can lead to stomach pain. Only by identifying these causes can we actually treat and resolve the issue. I am Dr. Anumod Kakkassery from Marian Ayurveda, Thrissur. Once, a husband and wife who were working abroad consulted many doctors there regarding their daughter's stomach pain. None of them were able to find out what the problem was. So they came to Kerala. Even here, after consulting several doctors in Kerala, they were still unable to diagnose the problem. That's how they came to our clinic. After this person arrived, as usual, my initial thought was that this was a common type of stomach pain in children, which is usually caused by acidity. Children experience stomach pain when they wake up in the morning. Saying things like not eating food or not feeling hungry are key symptoms of acidity. That's why I thought, since Ayurveda has very effective medicines for treating acidity, we could give those. Even after giving medicines for acidity, thinking that the stomach pain would go away once the acidity was treated, there was no improvement in them. What I then found was that a major reason for stomach pain in children is a condition called mesenteric lymphadenopathy. There is a membrane in the abdomen called the mesentery. It is a membrane that encloses and supports the intestines. Fluid accumulation in this area often causes sudden, severe stomach pain in children. The stomach pain also disappears suddenly. Sometimes it might happen when the child is about to go to school or at some other time. Even after 10 minutes have passed, or perhaps even after a full hour has gone by, you might observe the child running around and playing quite happily as if absolutely nothing had happened at all. However, when the symptoms do actually occur, the physical pain is known to be incredibly intense and overwhelming. In young children, this condition can cause sudden and severe abdominal pain that is very distressing to witness. In such frightening cases, worried parents often find themselves searching extensively on Google for information about appendicitis and other related medical doubts to try and figure out exactly what could be happening to their child. We think our child has a stomach ache. In many of these clinical cases involving young patients, what I have come to understand through extensive observation is that the primary underlying cause of persistent abdominal pain in children is frequently not related to a renal issue or any specific kidney problem as one might initially suspect. Instead, the evidence often points toward a much more common gastrointestinal condition, which is constipation. It is important to recognize that this discomfort is fundamentally caused by chronic constipation, which can manifest as significant abdominal distress. When we evaluate these symptoms, we must consider that the digestive system's regularity plays a crucial role in a child's overall comfort, and more often than not, the source of the pain is simply the buildup of stool rather than a complex organ failure. Therefore, we should focus our diagnostic efforts on managing bowel habits, as the root of the problem is almost certainly tied to the presence of constipation, rather than any serious renal pathology or internal kidney dysfunction. It is caused by constipation. Another very important thing to keep in mind is that if a child drinks milk and then starts to experience persistent stomach pain or has significant trouble passing stools after eating, we really need to take the time to find out the exact reason for these symptoms. It is crucial to observe whether these digestive issues happen every time they consume dairy products, as this information is vital for a doctor to make an accurate diagnosis. We should look into whether it is a simple case of indigestion, a potential milk protein allergy, or perhaps lactose intolerance. By carefully monitoring the child's physical reactions and documenting when the discomfort occurs, parents can help healthcare professionals determine the best course of action to ensure the child's comfort and long-term digestive health. In such specific cases, it is absolutely vital that we remain completely calm and proceed without any fear or hesitation whatsoever. We should take the time to carefully and thoroughly investigate whether the child might be suffering from a condition known as lactose intolerance, which affects how they digest dairy, or if there is perhaps some other underlying digestive complication or gastrointestinal issue that is the root cause of these persistent, painful, and uncomfortable stomach problems the child is currently experiencing on a regular basis. It is also important to observe these symptoms closely to provide a clear picture for a medical professional to evaluate the situation properly. At the same time, it is crucial to understand that certain types of stomach bacteria possess the unique ability to remain and persist within the intestinal tract for a long time. When these specific microorganisms continue to inhabit the intestines of young children, they frequently become the primary cause of significant abdominal discomfort and recurring stomach pain. This happens because the presence of these bacteria can irritate the sensitive lining of the digestive system, leading to various painful sensations that can disrupt a child's daily activities and overall sense of well-being. Therefore, the lingering presence of these microbes is a key factor that healthcare professionals often look for when diagnosing the underlying reasons for persistent digestive distress in pediatric patients. If a young child keeps complaining of persistent stomach pain like this, it could certainly be due to a bacterial infection in the gut, but it could also be due to several other common reasons like intestinal worms or sometimes even a more serious condition such as acute appendicitis. It is important to understand that while minor digestive issues are frequent, we should always carefully consider the possibility of appendicitis whenever a child experiences ongoing or worsening abdominal discomfort. This condition requires immediate attention because if left untreated, it can lead to severe complications. Therefore, parents and caregivers must monitor the specific location of the pain, look for accompanying symptoms like fever or nausea, and ensure they seek a professional medical evaluation to rule out any dangerous underlying causes and ensure the child receives the correct treatment as quickly as possible. As you may recall from one of our earlier segments in this ongoing series, we dedicated an entire episode to a deep dive into this particular subject matter, where we meticulously broke down the various diagnostic techniques used to identify the condition correctly. During that detailed conversation, we also went into great depth regarding the specific physical symptoms and subtle warning signs that you should be consistently monitoring and looking out for in your everyday life to ensure you stay fully informed and proactive about your health and well-being. So finally, if the diagnosis ultimately turns out to be a case of appendicitis, we must ensure that we are prepared to proceed with the necessary medical actions accordingly. Similarly, when we consider the condition of lymphadenitis, after the initial application of hot water and once that intense heat begins to subside, the patient will likely experience a lingering pain in the stomach area as well. Furthermore, after the inflammation eventually decreases and the swelling goes down, there will be a noticeable and soothing cooling sensation that returns to the affected area once again. Again, after using hot water and as it cools, stomach pain follows. Once inflammation drops, a cooling sensation returns. This will be a remedy for children who experience this. There are even more diseases like this. For this, spicy foods can further aggravate the condition for us.